Chapter 15 Safety. 1. The nurse is assessing an older adult client who has come to the emergency department with a possible urinary tract infection, which would alert the nurse that this client has been abused. A. The right knee has a large bruise. B. The underwear smells of urine. C. There are bilateral contusions above the elbows. D. There are small lacerations on the forehead. Correct answer. C. There are bilateral contusions above the elbows. Explanation. Bilateral bruises or contusions may indicate passive restraining, which could be a sign of abuse. 2. The nurse is completing an assessment of an older adult client whose primary caretaker is the grandson, which would alert the nurse that this client is a possible victim of emotional abuse. A. The client refuses to look at the grandson. B. The client reprimands the grandson for being late to the appointment. C. The client asks the grandson to leave the room during the pelvic examination. D. The client tells the nurse that the grandson isn't a very good cook. Answer. A. Explanation. Signs of emotional abuse include becoming quiet when the caregiver enters the room or refusing the answer if caregiver's giver is present. 3. Which statement by an older adult client to the nurse would indicate that the client is being abused? Select all that apply. A. I'm so cold all of the time because I don't have any warm clothes. B. I think I have a sore on my bottom. No one ever cleans me after I use the bathroom. C. Please don't tell that lady that brought me here that I showed you my bruises. D. I wish I had someone else to bring me here. That lady is a terrible driver. A. The lady insists on using the cheap soap to wash my clothes. I hate the smell. Answer. A, B, and C. Explanation. A is right because this statement indicates that the client is being deprived of adequate clothing and is a possible sign of abuse. B is right because this statement indicates that the client is receiving inadequate personal care and is a possible sign of abuse. C is right because this statement indicates that the client is afraid of the caregiver and is a sign of abuse. 4. The nurse has completed an assessment of an older adult client who lives with her son and his wife. The nurse observed some bruising on the client but no other signs of abuse. Which question by the nurse to the client would be most helpful in determining if abuse is occurring? A. Who manages your money? B. How did the bruises I noted on your wrists occur? C. Are you happy with where you live? D. How often do you see the doctor? Correct answer. B. Explanation. The nurse should find out how the suspected abusive bruises were obtained. This would be the most helpful question in this situation. 5. The nurse is caring for 4 clients and knows that which client is at the highest risk for falls. A. An older adult client who is 2 days post-operative from a hip replacement, uses a walker to ambulate, and requires pain medication every 6 hours. B. An older adult client who had a coronary artery stent placed 3 days ago. C. An older adult client who is preparing for discharge and requires continued antibiotics. D. An older adult client who was admitted yesterday for dehydration and is confused and sometimes combative. Correct answer is D. Explanation. This client was just admitted for dehydration and shows acute changes in cognition with signs of delirium. This client is at the highest risk for falling. 6. The nurse has just placed a bed alarm for a client who is disoriented and has explained its use to the client and his family. Which statement by a family member indicates a need for further information related to fall prevention? A. I know this bed alarm will help everyone know if my father tries to get out of bed without help. B. I wish this bed alarm would keep my father in bed. C. Now that this bed alarm has been installed on my dad's bed, I can go home and get a good night's sleep. D. It is so hard watching my father be so confused. I guess this bed alarm is better than nothing. Correct answer. C. Explanation. While the bed alarm lets everyone know if the client attempts to get out of bed, it doesn't negate the need for someone to be with a confused client. 7. The nurse is caring for a client who recently began taking prescribed blood pressure medicine. Which teaching will be most important to this client in the prevention of falls? A. Wear slip or non-skid socks when walking. B. Make sure that the lighting is good when you get out of bed. C. Use the handrails next to the toilet when getting on and off the toilet. D. Sit on the side of the bed for at least a minute before getting out of bed. Correct answer. D. Explanation. Blood pressure medicine may cause postural hypertension, so the client should be taught to sit on the side of the bed for a minute or 2 until the possibility of dizziness is over before getting out of bed. 8. While admitting an adult client for treatment of pneumonia, the nurse discovers that the client has been diagnosed with a seizure disorder. What safety precautions will the nurse put into place for this client? Select all that apply. A. Request that the client wear a helmet while out of bed. B. Place suction equipment in the room. C. Instruct the client to remain in bed at all times. D. Place the client in a room at the end of the unit to reduce stimuli. A. Pad the side rails and headboard of the bed with blankets. Correct answer, B and E. Explanation. B is right because suction equipment should be in place to prevent aspiration of secretions during a seizure. E is right because the bed, headboard, side rails should be padded to prevent injury in the event the client has a seizure. 9. The nurse is assisting a client to the bathroom when the client begins to have a tonic-clonic seizure. Which is the first thing that the nurse should do at this time? A. Assist the client back to bed. B. Take the client's vital signs. C. Time the seizure. D. Remove the client's clothing. Correct answer, C. Explanation. It is important for the nurse to time the seizure duration because it is impossible to know exactly how long the seizure lasts without timing it. 10. The nurse has been caring for a client who had a tonic-clonic seizure in the hallway of the nursing unit. Which is the first action the nurse should do when the seizure has finished? A. Reassure the client that the seizure has occurred and that the nurse is providing care. B. Assist the client to the bathroom to void. C. Ask the client to report the last memory prior to the seizure. D. Provide clear liquids to soothe a dry mouth. Correct answer, A. Explanation. After a seizure is over, the client is often confused and needs to be reassured about the present situation. 11. The nurse is discussing safety precautions at home with the parents of an 8-year-old child diagnosed with a seizure disorder. Which play activity would the nurse recommend to this family? A. Sitting quietly reading a book. B. Swimming at the beach. C. Riding a bicycle. D. Participating on a robotic team. Correct answer, D. Explanation. Joining a robotics team would allow the child to be engaged in play without needing direct supervision, and the other team members could intervene if a seizure occurred while involved in this activity. 12. The nurse is developing a safety plan for an older adult client who has just been admitted to the nursing unit. The client has limited hearing and eyesight. His medications include furosemide, Lasix, and a baby aspirin. He still lives alone in his home and is able to do small household chores, but his daughter comes over every week to take him grocery shopping. Which information will have an impact on the development of the safety plan? Select all that apply. A. The client takes furosemide. B. The client takes aspirin. C. The client has limited hearing and eyesight. D. The client lives alone. A. The client's daughter takes him grocery shopping. Correct answer, A, C, and D. Explanation. Furosemide is a diuretic and makes the client produce more urine, which means the client would need to urinate more. This should be included in the safety plan. The client's limited hearing and eyesight must be a part of the safety plan because it affects the client's ability to know of an emergency. The client's living arrangements are a large part of the emergency plan because the nurse must develop ways for the client to contact emergency assistance or to know if an emergency is taking place. 13. The home health nurse visits an older adult client's home prior to a client's discharge from the hospital to evaluate the home for any safety issues. Which situation, if seen by the nurse, would constitute the largest safety issue for this client? A. A trapeze lift has been placed above the client's bed to assist with getting out of bed. B. The house has one bathroom with a traditional bathtub. C. Skid-proof strips have been placed on the area rugs in the house. D. Most of the house plants appear to have dying foliage. Correct answer, B. Explanation. The client is elderly and the client will need to step into and out of a bathtub, which puts the client at high risk for falling. 14. The nurse is caring for a client who is disoriented and confused. Which is the safest and least restrictive way to assist this client? A. Place a wrist restraint on the right arm only. B. Dim the lights and keep the room as quiet as possible. C. Put a call light on the client's bed but remove everything else from the client's line of vision. D. Turn off the lights but turn on the television so the client thinks someone is in the room. Correct answer, B. Explanation. Confused clients often respond well to a decrease in both auditory and visual stimuli, so dimming in lights and keeping the room quiet will help keep the client safe. 15. The nurse is caring for a female client who has just completed taking a shower. The nurse notes that she is using her own hairdryer to dry her hair. Which is the nurse's best statement to the client concerning this possible safety issue? A. I noticed you're using your own hairdryer. We don't allow that. B. Before you start drying your hair, let me see if our maintenance department can come up and check it for safety. C. We usually don't allow clients to use their own electrical products from home, but if I don't see you use it, then I don't know you have it. D. Your hair looks good just the way it is. Please put the hairdryer away for today. Correct answer. B. Explanation. The policy in most facilities is to have the maintenance department check home electrical appliances for safety before they're used in that facility. 16. The nurse smells smoke and notes what appears to be a fire in the wastebasket in the client's room. Which is the nurse's first action when the fire is noted? A. Pull the fire alarm. B. Grab the closest fire extinguisher. C. Enter the client's room and immediately close the client's door. D. Assist the client out of the room. Correct answer. D. Explanation. The nurse must first rescue and remove all clients in immediate danger. 17. The nurse notices a fire at the end of the hall of a second-floor unit and recognizes that the clients will need to be evacuated out of the hospital. The nurse will use which carrying method to evacuate clients safely out of the hospital? A. Blanket method. B. Cradle method. C. Back strap method. D. Two-person swing method. Correct answer. C. Explanation. The back strap method allows the nurse to carry the client and navigate the stairs for evacuation. 18. The nurse is caring for a client who becomes occasionally confused. When the client has a period of confusion, he attempts to pull out his Foley catheter. When the client is oriented, he likes to do crossword puzzles. After receiving an order for restraints, which would be the best place, S, to place the restraint in this client? A. Around the client's elbows. B. Around the client's wrists. C. Around the client's fingers, using a mid restraint. D. Around the client's torso, using a vest-type restraint. Correct answer. A. Explanation. Wrist restraints may be placed on the wrist or elbow. If placed on the elbow, it will prevent the client from grabbing the catheter during confusion, but allow the client to do his crossword puzzle. 19. The nurse is caring for an older adult client who is very confused and is also very thin. The healthcare provider has prescribed wrist restraints to help prevent the client from getting out of bed. Which is the priority for the nurse in applying the wrist restraints to this client? A. The restraints must be applied loosely to prevent the client from rubbing the skin against the restraint. B. The nurse must pad the client's wrist bones before applying the wrist restraint. C. The restraints should be tied to the bed rails to give the nurse easy access to allow quick removal of the restraints if necessary. D. The nurse should use a wrist restraint instead of a wrist restraint to prevent injuring the client's skin. Correct answer. B. Explanation. The nurse must pad bony prominences to prevent skin breakdown from the restraints. 20. The nurse must restrain a child and knows that a blanket restraint will be best for which child in the nurse's care? A. A 7-year-old child who has a laceration of the forearm. B. A 5-year-old child who needs to have an IV started in the antecubital space. C. A 3-year-old child who has a laceration of the forehead that needs stitches. D. A 1-year-old child who needs a lumbar puncture to check for meningitis. Correct answer. C. Explanation. The blanket restraint would prevent the child from moving while treating the forehead laceration.